How would you describe your experience at Johnstown Heights?
It was miserable.
Tonight, critical questions about your tax dollars, the care of some of our state's most vulnerable, and the credibility of state inspections.
Do you think Johnstown Heights is getting a pass right now from state regulators?
Yes.
For the last 8 months, Denver 7 has uncovered major problems inside a mental health hospital north of Denver.
Because I believe it's not a safe place for patients or staff.
Chief Investigative Reporter Tony Kovaleski is discovering new information tonight.
It comes from former patients and workers reaching out to expose integrity concerns during so-called surprise state inspections.
This investigation centers on the performance of state employees inside this building. What would you ask a state regulator if you could?
Why are you overlooking so many things?
His concerns grew from what he witnessed as an employee, as a mental health technician inside Johnstown Heights. Why are you doing this interview?
Because I believe it's not a safe place for patients or staff.
And that safety concern sparked his decision to quit after 3 months on the job. He asked us to disguise his identity because he fears retaliation.
I quit.
Why?
I was assaulted twice, and the second time I was assaulted, I got sent to the hospital.
Details of the assault documented in this medical paperwork. What was the staffing like the day you were assaulted?
Very low.
He's questioning the performance and practices of state regulators, paid with your tax dollars, paid to make sure this hospital is properly staffed and is a safe place for mentally ill patients. Do you think Johnstown Heights is getting a pass right now from state regulators?
Yes.
An opinion driven by a lack of confidence in the quality and credibility of critical state inspections. Were these surprise visits by state inspectors, or did the facility know they were coming?
The facility knew.
Couple hours?
A couple days.
And this mental health tech is not alone in voicing those concerns. You went to Johnstown Heights to get help.
Yes.
Did you get the help you expected?
No, not at all. Not even a little.
She is a former patient, but her perspective includes 20 years of experience in the medical field, including time working in a mental health wing of a Texas jail. Overall, was it a safe environment?
I don't feel that it was.
After leaving the facility, she discovered her frustrations were not unique when her Google search uncovered prior reports from Denver 7.
With a place like this, with as many complaints as they have had and the issues that they're showing, they should not announce visits. They should be popping in randomly.
From what you saw, do state regulators need to take a closer look?
I think they definitely need to take a closer look, and they need to dig a little bit deeper.
This former nurse reached out to Denver 7 Investigates after resigning her position over quality of care concerns. She described and witnessed what she claims was the charade that unfolded after hospital leaders were tipped off about an upcoming state inspection.
Whenever they had state come in, they would staff up. They'd call people in and say, it's all hands on deck, everybody's got to be here. So it appeared to the state that they were fully staffed.
And yet another former employee also questions the integrity of pre-announced visits where she claims senior leaders at the hospital worked to muffle the message.
I know state has gone in there plenty of times to talk to people, but nobody can actually say the truth because somebody's always hovering, somebody's always listening.
In fact, we found this interesting. Uncovering the truth is at the heart of the inspections, confirmed by this state regulation. The licensee shall provide accurate and truthful information to the department during inspections, investigations, and licensing activities.
I feel like if it had been a surprise, there would have been a lot more issues that they found within the facility. Because when you have time to prepare for something like that, you are going to cover your tracks, and they're not going to find what is really going on there.
Which leads us to why inspections are critical to the safety of all patients inside this 92-bed facility.
He should not have died. It was not an accident that he died. It was negligence. That's why he died.
Last November, Christopher Dixon died in the detox unit at Johnstown Heights. An inspection by state regulators 9 days after his death uncovered at least 10 deficiencies and led to a declaration the hospital was in immediate jeopardy.
Are you surprised by what they found in the days after this death?
No, I'm not surprised. They found everything that I thought they'd find. Inadequate staffing, inadequate safety measures.
And that's the heart of this issue. Current and former employees have pressured the Colorado Department of Public Health to uncover the truth through unannounced surprise inspections. Since the hospital opened back in 2021, state records show 29 inspections producing 28 citations. But employees and patients say by announcing visits, state inspectors are not seeing the true picture. State regulators are going to watch this interview. What's your message to them?
Listen, please listen and look at what is going on there. Don't give them the opportunity to upstaff and hurry and clean and make everything pretty and shiny. Do the actual work.
When state regulators watch what you've said, what do you hope happens?
I hope that they rethink how they run things and that they're more thorough and pay more attention to things they seem to overlook.
Ultimately, stakeholders concerned about patient care saying oversight is overlooked by state regulators.
Stop this from happening to anybody else. Nobody else should lose their life being there. Nobody should feel less than a human being held there.
And we've discovered more support for the concerns you just heard. Back in April, the state issued its second immediate jeopardy designation to Johnstown Heights in less than a 6-month period. Which brings us to Elaine McManus. She is the Director of Facilities for the State Department of Public Health. We wanted to ask her to respond to the concerns raised by former patients and employees, the accusations of failing to conduct surprise visits. Our request for an on-camera, in-person interview was declined. Instead, in this email, the state pointed to current state procedures saying they regularly conduct unannounced inspections and specifically highlighted this: on-site complaint investigations must always be unannounced. Clearly, employees are seeing something different. And finally, we also reached out to Johnstown Heights CEO Sean Peterson. Once again, our calls and emails were not returned. I'm Chief Investigative Reporter Tony Kovaleski.